Rapid eye movement sleep behavior disorder, or RBD for short, is a parasomnia characterized by dream enactment behaviors. More specifically, acting out your dreams occurs due to a loss of what we call muscle atonia during rapid eye movement sleep. Rapid eye movement, or REM sleep, is the sleep stage where we are in a deep sleep and frequently dream. And muscle atonia is a normal function of REM sleep that suppresses our motor neurons so that we have very little movement and do not act out our dreams. However, in those with REM sleep behavior disorder, their motor neurons do not become inhibited. Most times, there are no known neurological disorder or cognitive/motor symptoms in the patient during wakeful behavior. REM sleep behavior disorder has a strong association with nightmares, which is why many patients report having physical movements during REM sleep that resemble punching, kicking, etc., and can be injurious to the person with REM sleep behavior disorder or their bed partner. It is usually after a bed partner notices the symptoms when people seek medical attention. Oftentimes, it will be recommended to take protective precautions during sleep, such as removing all sharp objects from sleep surroundings and putting padding on the floor and nearby furniture to reduce incidences of injuries during REM sleep. Additionally, pharmacological treatments may be prescribed to induce deeper sleeps and relax the muscles, such as melatonin or clonazepam. REM sleep behavior disorder is relatively rare. It is estimated to occur in 0.5% to 1% in the general population, but its incidence rises in older adults, up to 2%. REM sleep behavior disorder has a very strong male predominance, with an estimated 9 to 1 male to female ratio. REM sleep behavior disorder is thought to be largely underdiagnosed and misdiagnosed. Underdiagnosed because many patients go without noticing the dream enactment symptoms if someone else does not notice them first, and misdiagnosed because of the similarities to other parasomnias such as sleepwalking, for example. The cause of REM sleep behavior disorder differs from patient to patient, but the most common cause of REM sleep behavior disorder is a manifestation of an early sign of an alpha-synucleinopathy, such as Parkinson's disease, Lewy body dementia, or less commonly, multiple system atrophy. Sometimes REM sleep behavior disorder can be caused by things like antidepressant use, but it is more of a cause for concern when it is a prodromal syndrome of an alpha-synucleinopathy. Since REM sleep behavior disorder is often an early manifestation of an alpha-synucleinopathy, evidence suggests that RBD is marked by neurodegeneration of the alpha-synuclein protein. Alpha-synuclein is a highly soluble protein found all over the body, but primarily in neural tissue, and is assumed to play a role in synaptic vesicle trafficking and neurotransmitter release. Alpha-synuclein is encoded by the SNCA gene, and mutations in this gene have been linked to familial Parkinson's disease. Further, SNCA gene mutations are most associated with early onset Parkinson's, and REM sleep behavior disorder is also associated with early onset Parkinson's. REM sleep behavior disorder can sometimes look like other sleep disorders, such as sleepwalking. So the only way to diagnose REM sleep behavior disorder and rule out other parasomnias is with an in-lab sleep study using polysomnographic diagnostic methods. Polysomnography allows for the visual representation of dream enactment behaviors, captures these behaviors during REM sleep by measuring brain waves using EEG, tracking the rapid eye movements during REM sleep using EOG, tracking the motor activity using EMG, heart rhythms using ECG, and breathing functions. For an affirmative diagnosis of REM sleep behavior disorder, the EMG must pick up an excessive amount of electromyographic activity during REM sleep. The term neuroprotection refers to mechanisms and strategies to defend the central nervous system against injury due to both acute, such as trauma or stroke, and chronic neurodegenerative diseases. All individuals researching REM sleep behavior disorder and alpha-synucleinopathies should work together to identify how RBD can be used to slow the progression of Parkinson's disease, Lewy body dementia, and other alpha-synucleinopathies. Currently, there is a need for neuroprotective trials for those diagnosed with REM sleep behavior disorder, which would include measures to slow the progression of neurodegeneration and phenoconversion to an alpha-synucleinopathy. If you or a loved one has demonstrated symptoms of REM sleep behavior disorder, it is suggested that you consult a medical professional.